Public consultation is underway to discuss the proposed closures of Sure Start children's centres across the Solent region. Hampshire County Council are looking to reduce the number of centres from 54 to 11 in a bid to save £8 million. The plans have been met with fierce criticism from parents that use the facility, as Richard Ensten reports.
The patch in Calmore, Southampton, is just one of many Sure Start centres that could close if plans go ahead. It offers a large range of services for families with young children, everything from breastfeeding and postnatal support to nutrition and parenting skills. Catherine Overden is spearheading the campaign to keep the centres open.
At the moment we've got 54 centres in Hampshire. They want to cut to 11 centres for the whole of Hampshire, so if you don't have a car or you can't afford a bus, if there even is a bus, because buses are being cut back as well, you can't get there. And for me, if I had to travel 11 miles on a bus with a 1-year-old and a 2-year-old and postnatal depression, which was meaning I could barely leave the house, I wouldn't have gone. And if people don't go, they'll then say people aren't using it and they'll close it altogether. So it needs to be local so people can access it every day.
If plans go ahead, families using the centre in Calmore would have to make an 11-mile journey to Holbury in the New Forest to visit one of the 11 district hubs. Parents at the centre believe it will make the service inaccessible for many.
They're planning on just having the one hub in Holbury, or our local one will be in Holbury, which isn't the easiest place to get to, especially if you don't drive. It's, I think they pointed out, it's actually a bus, you have to catch a bus into Southampton and then out of Southampton to Holbury, which is a bit complicated and expensive. So I just don't think I can't see people going, which they're not getting that service.
The support to know, especially when you have a newborn, that on your doorstep you've got somewhere that you can go. For me, that was a massive thing.
It will cut out the children's centre as being an option for so many people because they simply won't be able to access them. It also, they're looking at charging for groups, so that will make it inaccessible to a whole load of other people as well. The County Council has a responsibility for safeguarding, and if they take away 43 of these children's centres, that's 43 places where this safeguarding isn't happening. You know, they're going to miss people will slip through the net, people who need help.
Councillor Keith Manns put forward the proposals to close 43 Sure Start centres and focus on helping vulnerable families. He says a reduction in centres will not mean a reduction in care.
I don't think we should consider just the 11 remaining hubs, if that is the decision I take, as the only way that families who need help receive it. Many of them will receive help in their homes when they need it, and that will be as a result of advice from GPs, from health visitors and district nurses. What is coming out of this, though, is that because of the times of austerity we live in, we have to focus on those families that really need our help, rather than provide what was originally a universal service.
Hampshire County Council hopes the plans will save around £8 million from their budget, but campaigners believe it will put extra strain on other public services.
If they cut back the early intervention, then the cost will just fall elsewhere, so people will be needing mental health support from the NHS, and mental health services they've got cuts as well. Hospitals, children getting into trouble, so that puts impact on the police. If they get involved in gangs and arson, fire service, which are also facing cutbacks, it trickles everywhere. Whereas if they just help families at the very beginning and support them, you can completely change aspirations for families and children and save money. That's what they want to do, is save money, then invest a little bit at the start.
Councillor Manns insists that while the cuts run deep, there are still services available for all families.
In an ideal world, we'd probably be not taking this action in quite the way we are in terms of the speed. But I think the direction of travel is not going to change in terms of focusing our resources on the area of greatest need. But I'd also say to families that don't have any specific problems, there are a number of other community-based organisations, small toddlers groups, just to mention one, the National Childbirth Trust to mention another, that are in a position to provide that sort of support and interaction that these families have been used to in children's centres.
Public consultation runs until the 3rd of May, with a decision expected later in the year. Richard Ensten for That's Solent.